Hello, everyone, and welcome to this month's conversation, Nursing Grads Beyond the Pandemic. It is going to be a discussion about how the pandemic is affecting new graduates and practitioners. We're going to be discussing how to address concerns for this transition. We're going to talk about tips for survival and success, coping strategies, and expected shifts in the practice moving forward. My name is Jessie, and I will be your host for this event. You won't be able to see me when we go live with this conversation, and that is by design. I want to make sure we're giving all of the wonderful attention to our speakers, but I'll be the background voice guiding this discussion for you. Now, before we begin, we have a couple of housekeeping things. Let's make sure that everybody participates. Share your name in the comments, where you're viewing from. If you think of any questions for our presenters as you're watching, feel free to type them into the comments, and we'll do our best to get to all of them before we get to the end of the discussion. And now, before we introduce our guests, I'd like to introduce Tanika. She's going to be talking a little bit more about our subject today. Tanika?
Hi guys, welcome. I just want to say thank you first of all for coming out and being with us on our live chat. My name is Tanika Bruce. I'm also known as the Network Nurse, and that's exactly what we're doing here. We are networking and connecting people. And I'm a registered nurse, I'm a doctoral student, and I live in the Tampa area. And it doesn't matter really if you're in the nursing field, it doesn't matter if you're entrepreneurs, whatever it is. We've got some amazing guests, and they're clinical leaders, they're entrepreneurs, they're educators, they're authors, and they have a passion for really helping their community and helping others. And so with that being said, we're honored to have the guest on our panel today, and we're going to learn a little bit about how the pandemic might be affecting new graduates and also practitioners as well through the eyes of these guests. And as Jessie said, we're going to discuss some of their experiences and some strategies, as well as just some adjustments that they've had to make in their respective fields, and how new graduates can really take advantage of their experiences as they shift from class to clinicals. We know that there's a lot of change that goes on, especially right now in the pandemic. There's a lot of thoughts, there's a lot of worries, and how we can take those things and just possibly just address their concerns for any kind of transition that they might be having. Maybe give some survival tips and also just some tips for success, whether that's personal success or professional success, and just maybe learn some shifts that we kind of expect through the rest of the time moving forward. So thank you, Jessie. I'm going to turn it back over to you.
Thank you so much, Tanika. It's wonderful to have these wonderful guests with us. Look at their faces. Hi, guys. Great to see you. So before we get started, we're going to kick it off with some introductory questions. I'm going to call on both of you to introduce yourselves. Let us know your title, position, and what you're doing these days. Let's start off with Nicole. Nicole, hi.
Hello, and this is not Halloween. This is my actual outfit, so I came prepared for the talk. My name is Nicole Cole. I have a DNP in nursing practice. I've been a nurse for over 20 years. I started out from very humble beginnings. I was a CNA, gained a great respect for nursing, decided to go back and get my RN. Then, of course, through that momentum, get my BSN, my MSN, and then finally my terminal degree. So I've had a great time representing nursing from CNA level to DNP level. I've been in leadership, in and out of leadership for the past 12 years as a manager of ICUs, director of critical care units. A couple of years ago, I decided to take a brief step away and really got engulfed in education. And I teach adjunct at Nova University and South University for graduate students there. And I also work as a hospitalist. I moonlight as a hospitalist ARMP. And unfortunately, a couple months ago, I lost my father to COVID-19. And so I took the opportunity after that to do some COVID staffing as a floor nurse, where he passed away in that hospital system, which has been really very cathartic for me. So, and besides that, and I think we'll talk about it later in the broadcast, but just starting a new education company, because I just think it's so important to continue the quality of care quality of care for our elders and our older folks. And so I'm going to focus this latter part of my career on education. And so I'll be opening an education company called Bannock Healthcare that I hope you guys will be checking out soon. So thank you for inviting me, Tanika. I look forward to the talk, and I can't say enough about your books and all the efforts you're putting forth with the Network Nurse.
We got, okay, Loree.
Can you hear me now? All right. Loree, what is your, where are you and what is your experience?
Yes. Hi, everybody. My name is Loree San Juan, and I'm here in San Francisco area. And I've been a nurse for 27 years, and it's been a wonderful journey since day one, and even pre-nursing when I too worked as a nursing assistant. I had the experience, actually before that, I actually volunteered here at Glide Memorial, which is a well-known worship center here in San Francisco. And it was from that experience where I worked or volunteered directly with passing out lunches in that population. It just really opened my eyes to what is possible in nursing. So again, I've been a nurse for 27 years, and most of my career has been in the public health setting. During nursing school, I had a big fascination for cardiac care, but then it shifted to mental health care and eventually here in the public health setting, where I currently work in a local health department, where my primary job pre-COVID has been visiting low-income pregnant moms and their families out in the communities, which is in their home setting, possibly meeting them at schools, sometimes in the jail settings, as well as their work settings or wherever they may be. You know, again, the focus is on public health and really reaching out to the community. And that's just been really my passion for my career. But, you know, now that it's, you know, COVID has hit, a lot of us at the health department actually got pulled to do more direct COVID work. So I actually work directly now, discharge planning, meaning I help patients that are actually COVID positive and making sure that they discharge safely and securely from the hospital setting into a home setting where they can continue isolation or however they, you know, they move around with their family. And we as public health nurses and nurses in general, you know, that's our job, is to ensure that the patients and, you know, all community members that we come across are in a safe space. So it's just been a wonderful journey.
You both have taken your experiences and you've made some really sad experiences. Nicole, I'm so sorry to hear about your father, but how you've taken those experiences and you've transitioned them into a gift. You've made such a gift out of what you can give the community back. So wonderful to meet you both. We're very interested here to talk about your story of how you transitioned as nursing graduates into work. And I'm sure a lot of it's so great to see so many comments. Hi, everybody. Please keep the conversation going. This is something that everybody is so interested in right now, is that transition time. So if we have some former students here who are currently practicing, you know, feel free to comment as well. But I would love to hear from your experiences. Nicole, let's start with you. How was it for you when you transitioned as a nursing graduate into work? Oh, and I think we lost your audio, Nicole.
Hello.
Hello. There we go. Yep.
I was just testing you just to see.
We're on it.
No, so I had two transitions. My first transition was as an RN, and that was pretty much like a floppy fish, if you know what that looks like. I really have to say there was three main people that I can really give a lot of thanks to in my transition to the RN position. And they were actually three LPNs. Two of them were twins, Gloria and Dot. And one of them was another nurse named Gloria at a local hospital I worked at. And not only the transition to the RN position, but at that time when I started out, I lived in a very small town where I often had to convince people that I was actually the RN. Like, really, are you? Like, oh, really, I am. So it was a transition of trying to come in with confidence, and really trying to give my patients the best care possible with my limited experience. And so how was I successful? Mentorship. Those three people really brought me through. And I think if you talk to any nurses that have been successful and really love what they do, they will attribute it to someone they met somewhere along their career that really helped propel them to wherever they were and help them feel comfortable. And I was laughing because I think there was a question sent to me about something funny when I was transitioning to the RN position. And the laughter came because there was nothing funny. I cried every day. But it was a good cry. It was the kind of cry that you take when you really care about what you do, when you want to provide the best job possible. And every day you go on shift and that's what you're trying for. That's what you're trying to get, because you remember that one day it might be you, it might be a parent, it might be a grandparent in the bed. And so that care you provide, you want it to be the same as you would expect for them. So that was my one transition. My second transition was after I got my graduate degree and I became an ARNP. And that was, I think, I feel a little bit, I don't want to, sad's not the right word, but I know it can be very difficult to transition in the ARNP role when you've only been a registered nurse for maybe 1 or 2 years. I had the ability to transition a little bit easier. I had been a nurse for 20 years. I was very aware of the hospital that I was working in. I knew the providers. I knew the culture. I knew the EMR. Can you imagine? Which is half of the trouble of being a provider, is figuring out the EMR. So I think for me, the ARNP role was a easier transition, except for the fact that if you look at Patricia Benner, when you go from novice to expert, right? Going from an experienced RN to the APRN role takes you from that very experienced nurse to a novice again. And so it was very humbling. So the main advice I would give people is be open to criticism, listen, understand that you're never done educating yourself. You always want to be educating yourself, looking things up, looking at the next best idea, following what's going on in the trends as far as at the NIH level, the CDC level, the guidelines and how they're changing. Always keep yourself current and relevant. And then I think that makes between preceptorship, mentorship, education, openness, and communication is a great recipe for success.
I love it. Was there something in particular you wish that you had known like looking back, you're like, if only I had known this, it would have been so much easier. Is there anything that you can think of specifically?
That I wish I had known? There was lots of things that, well, you know what? I wish I had known that you didn't have to know everything. I think when you leave school, there's such a lot of trepidation and anxiety because you feel like, what if I get to the unit and I get a patient with non-Hodgkin's lymphoma and I don't know what to do, and then you realize you have wonderful resources around you, whether it be through the electronic record, through different sources on the internet, or your peer group, the people around you. There was a lot of 1 a.m. calls to peers about, what they thought about this patient. And it was okay because they made the same 1 a.m. calls when they were new. So I think knowing that it's okay not to know everything, you have resources and people around you that are going to support you. And so the transition is not going to be as gruesome as you think it's going to be.
And I love how you said mentorship was such a big thing for you too. Like and the tiny nurse commented as well and said 100% mentorship.
Yes.
So yes, it's 100%. That is something so important, is to know that it's okay to ask questions. It's part of the learning process. So thank you so much for sharing that perspective, Nicole. I really appreciate it.
Absolutely.
Larnie, would you like to have a little bit of fun before I ask you your questions? All right, let's play a little bit of a game here. We have some wonderful gifts from Tanika and from this whole group. We're going to do some gift certificates, and what we're going to do is we're going to take a minute for the guests that are with us today to help some former guests win a gift card. So Larnie, do me a favor and choose a favorite number between 1 to 11.
Okay, 4.
4. Okay, that is Dorian Lee. So, Dorian, if you are watching, please comment below so that we know that you're watching, and we will hook you up with a gift card. Thank you so much. All right, that's fun. I love helping people give things away. That's always a good time. All right, Loree, let's talk to you. I know you are a public health nurse, and we know you enjoy doing that. What does that mean for those that are listening that might know traditional nursing jobs? How someone in the public health may even have a possibly tougher transition from school to the field?
Yeah. So thanks for asking that question. And so, public health nursing, well, let's back up. Like in nursing, what's beautiful about nursing is that there's so many specialties. There's even so many subspecialties. And public health is one of those specialties that I believe doesn't get a lot of spotlight because, most people think of a nurse being in a hospital setting. But that's all good because as a public health nurse, we're actually able to practice not only our clinical skills, but also for those that are interested, really exercise that aspect of us that have interest in looking at like the community lens, to looking at the social justice lens, to look at the inequality, to look at like why access is really not happening in certain populations. So it's really taking a microscope to what really affects healthcare. And so, public health nursing is just an all around opportunity for those that like the bigger picture. And also there's so many subspecialties in it, such as communicable disease, there's maternal child health, there's the elderly, there's specific maternal child health, there's CPS, there's jail nursing, and there's just a lot like packed in there. And traditionally, public health nurses, if you look at a job description, most health departments do want nurses who actually have had clinical experience. But at the same time, not all health departments require that. And most public health nurses are employed by a public health department. So every division's different, but there's definitely a transition, especially when one does come out of the or have experience in the hospital setting. It's a bit different in a public health setting.
Was there something in your life that was there this turning point that made you go, oh, I want to do this? Or was it just something that was presented to you when you were going through schooling? What made you go this route?
Yeah, I want to say like in life, when certain things just present itself, right? And kind of like when the cards are kind of like stacking towards that, that's really where I followed my gut. I actually get a lot of, in the beginning of my career, but maybe because I was aware to that, I was like, Loree, you should work more in the hospital setting. And yeah, that's maybe true. But for me, I actually, out of nursing school, I actually finished my bachelor's in nursing at SF State. And there was a part of me that still wanted more. I wanted to know the theory of health, the theory of nursing, the theory of why people even, why some people have better healthcare than others. So I actually personally pursued a master's degree in public health. So it's been inbred in me to follow this path. And it's just been an awesome, I'm so happy and so proud that I trusted my gut in that. Because it's really where my passions lie, is in public health. So I went back to school for it. And then when I finished that and I came back home to San Francisco, there actually were job openings. And it was just, I want to say, a blessing in disguise. So that's where I ended up where I'm at. And I actually haven't looked back. And it's just been something I'm super passionate about.
I love it. Thank you so much. What a great encouragement to follow your gut. It's so often that people question themselves and question the path that they're on. And sometimes they just need time to let that figure out, let that work out so that they can see they chose wisely. And there are so many beautiful opportunities for people out there that you just need to stick to it. You need to say, this feels right for me. And that felt right for you. And that's beautiful. Thank you so much. All right, let's bring it back over to Nicole. Nicole, you ready for some more questions? No, I know because you. Well,
Sure.
let's do it anyway. All right, so we know you're a leader in your field. As a leader, can you give us tips of survival and success, coping strategies, and expected shifts in practice that you've dealt with? What are some tips for how you can get through all of the different things that we have to handle these days?
Yeah. So I will tell you, when I'm teaching in grad school and we're talking about nursing theory, I show this video. I believe the gentleman's name is Charles Hunt. Very interesting young man. It was a TED Talk. And he talked about resilience. Amazing word, right? He talked about growing up in a lower socioeconomic class, being born from a mother who was high on drugs, having a father who was also into drugs. Subsequently, he was evicted from his house, had to move into his grandmother's house. His mother was incarcerated. His father was incarcerated. His father ended up actually being killed in prison. And yet here this man stands with a not only bachelor's degree, but a graduate degree in business in his own company. So what is resilience? You know, it's really about setting your intention. Is this a difficult time? Yes. Are we going to make it through it? Absolutely. And how are we going to make it through it? We're going to make it through it together. We're going to do that by using our support systems. We're going to do that by talking to one another and letting each other know, you know what, today was a bad day. And this is why. And this is how I can be here for you. Right. And knowing that, yes, even though we're having all these difficulties, that we can get through this together. My daughter, I think, is the number one person when it comes to talking with intention. And she's always telling me, don't put that out in the world. So I'm saying to nurses, let's not put it out in the world. Let's keep as positive as we can. The world is bringing us enough negative. So we're going to do this together. We're going to get through this. There will be an endpoint. And we will have an opportunity to sit down and figure out what we learned and how we move forward so we can improve care. So I think resilience and communication, again, always so important, and support, use of your resources. And I see it now, I have to say. I feel for the nurses of today. I had the opportunity going through my nursing career of being able to have families there from my loved ones. So they help support the patient in a lot of ways that maybe I could not. We're now asking nurses to not only do their clinical expertise but also be there psychologically for the patient, be there as a resource, as an advocate, as almost a family member, you know, which we did before to some extent, but even more. So we are asking a lot of nurses, right? So it's really going to be important moving forward that we stick together, that we give each other understanding, that sometimes we give each other time, and it's time to go off stage and just, you know, blow off some steam, because it's okay. You're human, right? But be resilient and knowing that we can do this. I have 100% confidence in the nurses that I work with, 100% confidence in them. And I know we'll move forward through this. As far as changes, I think the biggest changes that we're going to be seeing is really the infection control practices. You know, we're talking about, you know, how long are we going to wear masks? Is masks going to become part of your uniform? You know, are you going to meet patients at the door with masks? What about the outpatient setting where patients really are seen first? You know, how is masks going to really, and infection control practices going to change due to this? And I can tell you right now, I've been in a situation myself where you've worked on a unit where your patient is negative for COVID-19, and then you get a call 2 days later. Oh, I'm sorry, the patient's now positive. You've been exposed. Did you have your mask on? So I almost think it's part of your uniform. You bring your stethoscope, you bring your pen, you bring your scrub, you put your mask on, and that's OB all the way up to ICU. I think it's very important because we don't know who's positive and we don't know who's negative. And so it's always important to keep yourself first, keep yourself safe first. So those are the two things I would say.
Absolutely. Man, I wasn't expecting for that level of inspiration there. I absolutely love it. That was gorgeous. Thank you.
No problem.
All right. Loree, you got to live up to that now. You ready?
She won't have a problem.
I'm learning so much here. Thank you, Nicole.
Well, and we know we have a lot to learn from you too, Loree. So I know you're a nurse leader entrepreneur. Can you give us some tips of survival and success, your coping strategies, and your expected shifts in practice? Like, how are you handling things right now?
Yeah, this is a tough time. And I ditto everything that Nicole has shared, since the beginning of our time to get here together. And a lot of it is resilience. Mm-hmm. And, one of the comments she said earlier was about mentorship. Mm-hmm. And that's something that for me is important to hang on to, whether it is a nurse mentor or a mentor outside of, your work setting, is to hang on to people, hang around people that actually are positive and brighten the day. Someone who could listen, because as nurses, we pour our hearts out into those 8, 10, 12-hour shifts where we don't get breaks hardly. But after a long day, it's super important to be able to decompress and just be around positive people. And I really appreciate what Nicole said. And a lot of it, too, is that whole resilience factor. But I believe resilience is a skill, and it's actually built. It's you gotta fail and feel bad so many times to finally recognize that in ourselves, to say, oh yeah, the last time I felt like this, I did call, my butt, or I looked it up and, what that lab value was. There's always an answer for everything. And, as for anybody, especially new grads, as you're trying to learn everything, and it's like you want to know everything. And like Nicole said, you don't have to know everything. The beauty of today is that I think most of us humans understand that. And I'm certain most people want to help. It's just, you got to ask. Mm-hmm. What I learned is to ask, especially when you need help, because there are a lot of people who really want to find answers with you. And as for those new grads, I highly recommend to just keep going. You got to do something long enough, even if like you kind of hate it or like you give up. But one thing I learned is when I mentored, for like, they were new grads, but now they're not so new grads. They've called me back and actually said, Loree, thanks for pushing me. Even when those shifts were hard, we got to go through that. Us nurses got to go through that mud in order for us to really realize if nursing is also something you do want to do for the long run. So it's just about getting back up every time. Even on those bad days, just get back up, because there's always that brighter day. There's a lot of bright days. And just like Nicole said, will this situation get better? I absolutely believe it will. And I really think the human race is going to be better, just because if we hit this rock bottom, well, shoot, we can only go up and just get better. So
absolutely. Wow. Equally inspiring way to level it up here, people. Absolutely gorgeous. And Tanika, you're looking so beautiful over there. I know you're just enjoying being the brilliant brainchild of this forum, and you want us to spend our time focus on the guests. But listen, I know I speak for them and everyone watching when I say that we're interested in your perspective as well. So you're a leader, you're an entrepreneur. Do you have any tips for survival and success right now in the field as well as outside of work? Because it's not just nursing that you do now. You are leading this forum and all of these things, this entrepreneurial lifestyle that you're doing right now. There's a lot that you're juggling. Do you have some tips? Because I'm looking to learn.
Well, first, I don't appreciate having to go after Nicole and Loree, but I'll definitely do my best. I think the first thing is self-care and self-reflection, whether you are working in a hospital or public health or whatever it is that you're doing. Because, let's be honest, nurses, we're the worst patients. We don't take care of ourselves. We take care of others. That's what we do. And we do it without hesitation. We're just selfless, and we have this ability to take on everything from everyone else. And then whatever's left in the tank for ourselves, which is generally nothing, that's what we're left with. So I would just encourage everyone to really find that level of self-care, whether it's whatever is your favorite hobby. If working 50, 60, 80 hours a week, then take that opportunity when you have a day off and you have that time to, one, sleep and rest, but two, just take a deep breath. It's okay sometimes that you're not okay, and that's the biggest thing. We have this ability sometimes as nurses to say, everything's fine and keep moving, and you don't really know, your brain from your ear. You just don't know when you have so many things going on, whether you're an entrepreneur or whether you're a nurse leader or a clinical expert. And so that deep breath, or just doing the things that you love, finding whatever it is that are your passions, and then just taking those things and capitalizing on the time you have, and reflecting on the things and the reasons why you became a nurse in the first place. And kind of like Nicole, I started out as a CNA, and then I went to a medication aide, and then I went to LPN, then RN, then master's, and now doctoral. I know we're crazy. I think the more education, I remember what Nicole said to me the other day, the more education we get, it's like, I don't know, people's brain cells. I don't know. But taking that time to just deep breathe and just say, okay, maybe I'm not okay right now, but let me just take a step back. And when you start to reflect on why you became a nurse in the first place, it really elevates, it elevates everything that you do. And just real quick, I decided to be a nurse. I had already, experienced a lot of success in the field and was a business owner, entrepreneur, and business consultant, some other things, basketball coach, and a lot of things. So I didn't come into the nursing field just kind of bright-eyed from high school or whatever. I pretty much came in as an older nurse. And so I had experienced a lot of things, but I started nursing. It wasn't really actually my initial choice. My mom's a nurse for years. And she would always say, you need to do nursing. And I'm like, yeah, right. And I was done coaching basketball. And at that time, I had an opportunity to be at my mom's house, and my grandmother was there. And long story short, I got a chance to see how just the selflessness of my parent to take care of her parents, just that in itself, and the people that were caring for her. She passed away during that time, and I got a chance to just find her and see her there. And she was still warm. She still had a smile, and she dedicated most of her life to being a CNA in the service of others. And it was just a no-brainer. It was like, man, I have to be a part of this. And I knew what it was. And so my passion and purpose is leading and just developing people. So it doesn't really matter what setting you're in, but always reflect on why you became a nurse in the first place. And it will bring you to that point of, okay, got it. Now I'm back where I need to be. Let me take a deep breath. And then now is the time where that resilience kicks in.
I love it. And if you are a new fan of this channel, and you might have missed the last live chat, but it's still there and it's up, so you can go back and watch it. It was all about self-care for health professionals. Tanika, your guests that you invited that were specifically geared towards that were wonderful. And I never understood as a non-nurse how much you guys take on yourselves. And like you said, just having that breathing, so important. So absolutely, guys, if you're new to this channel, check out the last episode of this, because it's so important to keep yourselves going. So absolutely beautiful. Thank you so much, Tanika. All right, let's bring it back over to Nicole. Are you ready for some more?
I am, but can I just say what Loree said about there's no place else to go but up is 100% true. So well said, and I'm waiting for the upside now. I know it's coming. Go ahead.
All right, well, it's going to be pretty much like a expounding on the last question. How are you preparing young new practitioners going into advanced practice during this time?
Well, I'll tell you, it's really been a challenge. And I think if you speak to most graduate faculty, they'll tell you the same thing. Our nurses, our nursing students are now being asked to go to the clinical area, and where traditionally they would see a patient, do an assessment, do a workup. Some of this is being done over the phone. So how do you hear an S3 or how do you hear crackles, or how do you see accessory breathing, or, judge abdominal tenderness when you're talking to someone over the phone? So there's a big portion of their education that's missing, that hands-on. And also it's been difficult because I've been in clinical sites myself where I've gone to review students, and patients and families have not been comfortable with having that many people in the room. And that's okay. That's their right. And they're correct. And so how do we deal with those issues as well? So I think for this particular group of students coming through, they are extremely challenged. However, I also believe they're up for the challenge. So one of the things that we do is we do a lot of case presentations during class. We talk about what patients would look like, sound like, what assessments would be positive. We do a lot of case study presentations done by students where they say, okay, if I had this kind of patient, this is how they would present, almost, just kind of scenario based, so they can kind of get a feel for what are those things they would see or hear or touch if they had that ability on a patient. So we even had several graduate students when we first were heavy into the pandemic, when it first started really hitting us hard, that had to stop their clinicals completely. So you have nurses in ARNP or APRN school right now who have to make up hours for the quarter or the semester before, have to complete hours for the current semester, who also have to work full time and take on overtime in this COVID environment and take care of their families. So I think from my perspective, it's all about being patient, being understanding, providing as much scenario-based learning as possible so they get an idea of those things they would normally see, hear, and touch. And being a lending ear when things get difficult, because things have been difficult for a lot of students. And my hat's off to them for their just fortitude and wanting to complete this course no matter what, because this is what their ambition is. So those are some of the things.
Absolutely. I love Margie just commented and said, being a nurse is no joke, but serving others is like serving God. Oh, I love it. Thank you so much.
Very true.
This was very deep. Let's have a little bit of fun for a second, Nicole. Okay, you ready? I'm going to let you. How about you choose a number between? What's your favorite number between 1 and 11?
11.
Oh, of course,
Yeah.
11. Okay, 11. So let's see. Who is 11? 11 is Jamie Hoven. Just won a gift card. Thank you very much. That was a little bit of a moment of levity for everybody after all of this super deep stuff. I love it. I love it. Yeah. All right. Larnie, are you ready for some more talking?
Always ready.
I love how Nicole said earlier how Tanika had commented about, was there any funny stories or bloopers? And she's like, nope, it was all crying. Was the experience the same for you, Larnie, or do you have any funny stories of when you first became a nurse practitioner or a new nurse as you were getting into it?
Wow, there's a lot. But in terms of, just like stories and what excites me about this is that, there's just this every day with a patient, you just meet somebody new and you just don't know what the shift is about. And to me, it's super humbling. I think that's really one of the best gifts that I get as a nurse is the ability to actually learn the intimate aspects of a person's life story so that we're a part of that journey with them. And then we, share our nursing perspective. And that's just the beautiful part of it. I'm not thinking funny right now.
No, I love it though. That's wonderful.
Right now it's more of the beauty of this journey in nursing. And so for new grads, I extend to embrace every shift that you go through, because the gift we have, to be part of someone's life and to watch them heal or not heal, but to be able to just be part of that is really a humbling experience. And that really grounds me a lot. After my long days, even life in general, right? When life gets tough, I mean, I have, my challenges too. I have my own health challenges as well. I need a nurse as well. But it's really just looking inside out so that we could give back to the people that we are serving. So it's just been, there's a lot of stories that go on, and it's just been great.
I love that, because and that's bringing me to my next question beautifully. Thank you very much for that. But I want to keep on you for just a second so that you can kind of reach into this too. I'm sure there are some other people that are watching that are not nurses. They may be family of nurses or friends of nurses or teachers of nurses. Loree, how can we support you guys during this time? Is there something in particular, other than like gift certificates to a spa, if there are any open right now? What is it that you think that most new or established nurse practitioners or nurses could really use from us as your support structure, your community?
Yeah. Wow, that's a nice question. I want to say that's rarely asked, because sometimes, the field of nursing, it looks easy, right? Because it's also very kind of a popular major to get into, and people want to do it, which is great. But that's really the first time someone's ever asked, like, what can we do for you guys? Wow. And for me, a simple thank you goes a long way. It's not even about the gifts or any of that for me. And it's really just creating awareness of, what's put on at the bedside with the patient, or even just really what we bring to the table in the healthcare setting. Because nurses I want to say, are like literally, they are the backbone of the healthcare system. And most oftentimes, like when it's Nurse Week is when it gets recognized. And now with COVID, it's, nurses have now, gotten more attention. But every day, for those of you listening, nurses are there 24/7. Most nurses are very committed to this field, where, we were joking backstage. Sometimes, we don't get breaks. Oh, wait, did I go on my break already? I don't know, because you've been so hardworking. But then again, that's also a natural part of who we are. And we chose this field. For those that miss breaks, there's a reason why. I mean, I don't promote that, but there's a reason why when nurses do miss their breaks, we just get intently into the job. And, that's also what makes our engine run too. So it's great. Yeah.
I love it. Thank you so much. And Nicole, do you have anything to add? I want to bring this question to both of you guys.
Oh, yes. I prefer gifts. No, I'm just kidding.
Send us your address so that everybody can respond in kind.
No, I think Loree said it. I really think she said it all. Something as simple as a thank you goes a long way. An understanding ear. When you get home and things have been frustrated and you kind of just want to express yourself, just people being non-judgmental. This is a very difficult job, and sometimes you don't have your game face on, and you may not have that funny story. And so just letting that your loved one know that it's okay. If you need to decompress, that's all right. When you're ready, let's come back. Let's start over. Let's have a conversation. Understanding it's not about you per se. It's not directed at you. It's directed at the fact that it's a very difficult job, especially right now. And for people who do it in a caring and considerate way, it weighs. It weighs on you. So you need ways to decompress. You need time to decompress, and family members that can be understanding of that, and say people who say thank you. Make all the difference in the world.
I love it. So just from us to you guys. Thank you. Not
And
just
gifts.
and gifts. Right. PM me your address. Okay. Thank you guys, not only for your time and like your patience through this exhausting time right now and your gifts that you're sharing with the community, but also for your time tonight. Thank you so much for your insights. There was so much good information in the last 45 minutes. It's helpful even for people like me that aren't in healthcare, just to have that perspective of what you guys are going through. Just beautiful thoughts and advice. Thank you both again so much. Before we conclude for today, well, actually, you know what? Before we super conclude, I have one more gift card here and I have nobody to give it to. So, Loree, do you want to choose another number between 1 and 11?
Okay, let's see, 4.
Wait, no, you chose 4 the 4th spread. That must be your favorite number for real.
Okay.
All right.
9.
9. Okay, Kesha or Keisha McClish. So if she is watching, drop a comment below, and you also want a gift card. Thank you. So that's a fun little way to conclude this, right? Just throwing out money. Why not? So thank you guys so much. And thank you for everybody that joined us today, sitting and commenting and sharing the love. There was a lot of love given in the comments. There were some beautiful questions as well. I wish we could have gotten to them all. We had so much beautiful packed in information. We weren't able to get to all the questions, but thank you for everybody for commenting and for participating with us. Please mark your calendars now, for our next live event is going to be on November 6th is going to be our next live chat. So put that on your calendars right now. And we also have a webinar coming up on 10/17. Handpicked, is this our webinar? Yes, join our free webinar, handpicked tips, things you only learn in the field. So this is especially great for the newbies who are coming in and don't have that practice yet, things that you're gonna learn in the field. And what else we have? Oh, we might have a launch of a new company, Bannock Healthcare. Look at that. That looks like a familiar person. Congratulations. So excited for you to be opening that up, Nicole. We are so excited for your launch. And so everybody stay tuned for information about that. In the meantime, we will see you all at our next chat on November 6th. Again, thank you all so much for joining us, and we'll see you next time.